This morning, I woke up to several questions about testing, and you guys know I appreciate questions, so thank you for asking. So let's talk about what we do before we get to testing. You all want to have alternative interventions done, not just for your kids, but for yourselves, because you see, we don't just jump to testing for kids, right? Just because you think your child may have a learning disability, for example, doesn't mean that you just automatically get approved for testing by our special education team in schools. So what we like to see is for kids to have interventions, right? And so interventions can be curriculum-based assessments that track reading, math, sometimes writing, and also sometimes behaviors, right? When your kids get alternative interventions, you as a parent want to monitor them with the school. So I'm not talking about MAP testing, for example, in Illinois. You can track scores for MAP testing like I do for my own kids because, of course, our school districts send out the MAP scores. But what I'm talking about is ongoing curriculum-based assessments. Teachers track these things, and not just special education teachers. General education teachers have privy to these curriculum-based assessments as well, and they can help you to determine if the interventions that they are doing are actually working. Now, don't expect interventions to work overnight. You got to get that out of your head. So some people will think, okay, they're doing interventions. We see 1% progress. It's time to move to testing. That's not how it works. Sometimes interventions can take a year. Sometimes they can take 2 years. My thought is, as long as it's working, that's what we want, right? Now, should it take an excessive amount of time to see differences? Not exactly. And if all of you mean the special education team, and you as a parent, if you feel as if everything that you all are doing, including what you're doing at home, is just not working, then you all may decide to move to testing. Now, that's in the schools. At home with little bitty toddlers, I always tell you, you are the expert. You are the parent. If you really feel like something is going on, for example, your child is not talking, at least using 2-word phrases by the time they're 2 years old, then you might want to keep track of that. You might want to consult with your early childhood program in your area, and you might want to have a screening for speech by a speech and language pathologist. You can do all of those things and put interventions in place to help your child before you move to testing. So when we get a testing question, one of the things that I'm looking at is IEPs, if they have an IEP. What's been done in the school? How long has it been done? What are you doing as a parent? Because you guys know you can't just count on the school to do everything for your kids. You have to take accountability as well and do some things at home to help your child. Sometimes I see parents that do not know how to do things such as playing with their kids, playing with them, imaginative play, social imitative play, interactive play, parallel play, rough and tumble play. You see a lot of men roughing their boys up and things like that. Boys do that stuff. That's rough and tumble play. So you want to watch for all those things. If you have a preschooler that might just be isolating him or herself, then that is something that you pay attention to, right? And so if you decide to move to testing, how old do kids have to be to get tested? We test kids as young as 18 months. We have infant cognitive tests, right? Are you too old to get testing when you hit 16? Absolutely not. Are you too old when you hit 25? Absolutely not. Some of you have asked me, can you have testing and you are in your 40s and 50s? Absolutely. Remember, we have tests that go all the way to individuals that are 85 years old. So we can test you for a very long time. So you don't have to question whether or not you need testing if you are an adult. It's a little bit questionable with children because children have a long way to go. But some of you do ask me, or you just asked me because I woke up to it, can I have testing? and I'm 60 years old. Yes, you can. We diagnose dementias. You know, when we look into our DSM-5, which is this book here, published by the American Psychiatric Association, we diagnose dementias, right? So with that in mind, think about it in terms of, yes, I used to do a residency, or we call a practicum or internship. I think it was my practicum at a hospital in Chicago. And I was trained to test for dementias. So yes, we can test for those things, guys. Neurologists do it all the time. Or they will refer for neuropsychological testing, where neuropsychologists get involved, and they do all kinds of measures to assess, you know, the different areas of the brain that we see that may have some decline in memory and things like that. So you don't always have to be nervous about whether or not you can get testing. If you want testing, the waiting list may be long. I'm not going to lie to you. The waiting list may be long. However, you don't have to be afraid to ask for testing. Another question that I had is ADHD. Can ADHD be tested? We absolutely can test for ADHD. If you believe your child may have symptoms that are indicative of ADHD, then you can absolutely take your kid to see a psychologist and go for testing. Psychiatrists don't do psychological testing. It's us. We do that. And so most pediatricians or even psychiatrists or even social workers, when they think that the symptoms are beyond just diagnosing in the moment with them, what they'll do is they'll refer you to someone like me who will test for ADHD. So I'm actually going to write a blog, the next one, all about how to go about testing, the recommendations, the referral process. I will put that in detail for you. But for now, if you do think that your kids need testing, make sure you talk to your pediatricians, you talk to your school, your general education. Start with the classroom teacher, and then this classroom teacher will help guide you, because classroom teachers know your kids very well in their classroom. At least they should. And so they can help you to determine whether or not they think, you know, what they're seeing is beyond the pale of what should be occurring for your child developmentally. Going back to ADHD, because this was a question that came up, you know, a couple of times. I want you guys to have your kids diagnosed before they're 12 years old. Okay. We always have to talk about if the kids meet criteria. Okay. So 12 is that cap for little kids for ADHD. So kind of look into that. Consult with a neuropsychologist or your pediatrician or someone like me, a psychologist. But what I don't want to see happen is for you to jump to various things before you have a proper diagnosis. So some physicians help us out because our waiting lists are so long, right? But if you really do not believe that your child has ADHD and your child is hyperactive, inattentive, and busy all the time, but also having restricted and repetitive behaviors that I talk about a lot, then I want you to find an agency similar to who I work for, or find a psychologist who specializes in autism, and make sure you guys determine whether or not it's autism versus ADHD. So I hope that answers some of your questions. Thank you, and keep them coming. And thank you for asking. Have a good Sunday.